Welcome back to Hello Nigeria. Now, did you know that in cases of infertility or in cases where couples suffer from infertility, 1 in 5 cases are actually blamed on the male? Unfortunately, we live in a society that blames it solely on the woman. Today, we're looking at the preservation of fertility, not just on the part of the women, but also for the men. And to discuss this with us, we have one of Nigeria's 100 most influential women by Leading Ladies Africa. Her name is Dr. NINI IYIZOBA.
Yes.
Yes, thank you so much for joining us.
Thank you so much for being here.
Thank you for having me.
Doctor, I don't know why I keep calling it NINI, but I know it's NINI.
Yes.
Where is the NINI from?
It's just NINI. I don't know.
Really?
Yes. My mom likes the name. I think she heard it from one of her friends. It's NINI Kanwa, but I can't say that because I'm not Imo State. So
okay.
I have another name, it's Chinaza.
Oh, interesting.
Yes, but NINI is my middle name, so I just went with that.
It's good to have one of Nigeria's 100 most influential women seated with us on the couch.
That was another honor.
NINI IYIZOBA. Yes, I was.
Yes,
good to
right.
have you. Thank you so much for joining us.
Thank you for having me.
So I think we should just go straight into the point. When we think of infertility, we live in a society that just think it's always the woman's fault.
Right.
Why is that, and is that really the case?
Well, no, it's not the case. I guess because we're the ones who actually birth the children. So people usually just say, oh, it's her fault, it's her fault. But actually, it's actually equal. You know, male infertility it's equal to female infertility. So I think we need to change that in the minds of people, the minds of in-laws and all of that. Yeah, it's equal amounts. 33% is due to male infertility, 33% is due to female infertility, and the 33% is due to a combined, issues. But yeah, it's the same thing. So I don't think people should and most times you find women go into the hospitals, they go by themselves. I'm like, take your husbands, you never know. They need to get checked too. It's both of you. So yeah.
Now, there are also several things in society that can cause infertility, of course. What would you say are the leading factors that we are seeing today that really and truly are making infertility so prevalent?
So like now, infertility now is 1 in 6 couples actually have difficulties actually having a baby. So, and if you go back to like past years or past decades or whatever, it wasn't like that. So we're obviously doing something wrong, or something that's going on in the society or in the environment that's making it more difficult. And that's true actually. Lifestyle, toxins in the environment, age, smoking, alcohol, those are all the things we're going to discuss right now that people take for granted, but they actually do affect fertility. And I feel like the more you get that out there, more men and women would know better so that they could start, cutting back on different things that actually could affect their fertility.
At what point should a couple be bothered when they've not had a child? So we find that in Nigeria, the moment you're getting married on the wedding day, they're singing in 9 months' time. We will come
I know, right?
And there's this pressure.
Such pressure.
Exactly. 9 months' time. Exactly.
Like,
so much pressure on the couple to have a baby in 9 months. And the first prayer is, we'll come back again to celebrate with you in 9 months.
Right.
But that's not always the case.
Exactly.
So at what point should a couple start panicking, when they've not yet been able to have a child?
First of all, I want to say that, I don't like the idea of, that pressure. You never know, maybe that's their plan. Maybe that's the couple's plan, that they want to wait like 2 or 3 years or whatever before they actually start. But for those that are trying to have a baby, I would say if you've had unprotected sex for a year consecutively and you haven't had any results, that's the definition of infertility. But that after a year, then you could go see your doctor and say, okay, what's going on? We've been trying, regularly. Regular is not once a month now. If you've been doing it regularly, we've been trying and it's not working. After a year, you could go see your doctor. But, don't let pressure from parents or whatever, put you under that stress, because, stress is also not good for fertility.
And what are the dangers of actually stigmatizing infertility that people often overlook?
I feel that, most times when we stigmatize it, it causes a lot of depression. Not just depression, anxiety, and you're actually hurt. It causes more harm than good, because people, instead of coming out to talk about it openly, then they, go back into their shell and like, I'm not going to talk about it. Something is wrong with me. Nothing is wrong with you. I feel like a visit to the doctor can actually, if you're having issues, you could just go to your doctor and discuss whatever it is. There's so many things that could be causing a delay in conception. And most times when, people are like, when they stigmatize it, they have that fear of coming out to talk about it. And I feel like I don't think it's a big deal, really.
Yeah.
So now that you're talking about the fact that people should go see their doctor if they suspect that they're having infertility issues, What are the available options?
Well, there's a lot of options out there. We can't even go into all of them, but depending on what case you have or what issue you have, sometimes it's a reproductive issue. So people have stuff like fibroids, polycystic ovaries, endometriosis, and all of that. Those, I mean, and that's another thing. People don't go to your doctors. And if you don't go to the doctor, how do you find out these problems, you know? How do you find out there's an issue? Because sometimes when you do go to the doctor, majority of these people actually go on to have, you know, babies. But besides that, you know, the issues with the baby thing, I feel like if you do go to your doctor and they tell you that there's a problem, there's advanced technology now, IVF, IUI, surrogacy. There's so many options.
But how well receiving are we of these available options in Nigeria?
That's why it took me you know, most times people just, you know, frown at it. You know, it's when we haven't gotten to that stage yet that people just accept it. Oh, really? You had babies by surrogacy? You know, Kim Kardashian just did that with her last child. I don't think we've gotten to that stage yet. A lot of people are doing it in Nigeria, but they're not as vocal. And I don't really blame them because we're very judgmental. That's the word. We're very judgmental of people that have issues, you know, and then they say, oh, no, that's not even her daughter, or that's not her child, or that's not her baby. Who says so? I feel like people go through different things, and there's many ways to kill a killer. What's that? There's many ways to kill a cow, or many ways to kill a cat. Yeah, a rat. So I feel like, you know, there's many options. There's egg freezing. So when we go into the factors, those are other things we can consider doing right now to preserve your fertility. Because as a nation, we're actually waiting longer to have babies these days.
I was actually going to ask about that. What are your views on egg freezing? Should every woman consider it, even if they don't know whether they can get pregnant, whether they can't get pregnant? Is that an option that every woman should look into at a young age just to be on the safe side?
Medically speaking, I would say, okay, the truth of the matter is this. Fertility, the mainstay of fertility is your egg, you know? And as you do get older, your eggs get older. Sorry to say that, but that's just the truth. So as you get older in age, your eggs get older, and that's what you use to procreate. So in our 20s, we're most fertile when we're in our 20s. In our 30s, it kind of starts, you know, coming down slowly. By 37, it takes like a nose dive, you know, downwards, you know? So I feel those are the facts, those are the medical facts. By 37, it just goes down. Your fertility goes down like tremendously. That's not to say that we don't have 40-year-olds and people in their late 40s and early 50s having babies, but I feel like nobody is really honest about what they're really doing, you know? If you find yourself like maybe in your late 30s and you haven't found a man yet and you're waiting for that, I feel like egg freezing is something you should consider because it just gives you more options. I'm not saying that every woman should do it, but if that's something on your mind, I think egg freezing is something you should consider. You know, so like if maybe you find a husband by 40, you know that you have your eggs, you know, your younger eggs somewhere just waiting for you if at that time it's difficult to have a baby. I think it's something that, you know, I would advise it.
Makes a bit of sense.
Yeah, it makes a bit of sense, you know. It's just like storing away food for a later day.
Food in the freezer.
Yeah, exactly.
At the end of the day, everybody should do what works for them. And I personally don't have a problem with people who decide they want to do IVF or freeze their eggs. What you're doing is you're not killing anybody, you're not hurting anybody. What you're doing is even giving yourself a chance to be able to have a baby. Although I know some people will come with the whole, oh, you're not God argument. But we're going to go into that argument some other day. Let's talk about how to actually preserve your fertility for the men and for the women.
For the men and for the women. So certain habits that we indulge in daily or, you know, part of our lifestyle that we do take for granted that actually hurts our fertility. Number one is smoking. So, and when you say smoking, you have to add in alcohol, even though smoking is the main thing, you know. If you do smoke, you hurt your chances of getting pregnant. And not just that, you have a higher risk of having a miscarriage. And if you do have your babies have a increased risk of suffering like defects, birth defects and stuff like that. So smoking is the number one thing that hurts your chances of having a baby. And when I say smoking, most people automatically think I'm just talking to the women. No, that goes for men and women as well. If you don't smoke and your partner smokes, it's equally as dangerous because...
Oh, really? So if the man smokes and it...
Yeah, because that's secondhand smoking for you.
Okay, true,
and,
though.
yeah, that's secondhand smoke. And obviously, the smoking as well for him hurts his sperm counts. Yeah, so
Okay.
it's equal for both of them. None of you should be smoking. Alcohol, if you drink excessively, I would advise to cut it down. Maybe a glass of red wine from time to time is okay. Caffeine is good in moderation. You know, I remember back in med school, I used to have like 6 cups of coffee a day, and I would think that's actually normal. So if that's your normal, that's a no-no. Have a cup of coffee if you want to, but not 2, 3, 4, 5 cups, because that caffeine adds up and hurts you.
How's 1 cup a day?
1 cup a day. Fine.
Now I'm just asking for myself.
Why would I ask you 1 cup a day? Because there are people who cannot function if you don't have 1 cup of coffee a day. Is that a problem?
I had to tell myself, I think it was, you know, sometimes you have to tell yourself, you can do without this coffee. Because sometimes I'm like, no, I need some coffee. I need some coffee to wake me up, you know. And it's a habit that you can actually quit if you just put your mind to it and say, no, I'm not doing this.
So alcohol,
Yeah.
cigarette, coffee.
Yes. Next thing is toxins. When I say toxins, a lot of the things that we use these days, household products, our perfumes, our detergents, our soaps are filled with toxins.
Insect killers?
Yes. Oh my gosh, yes. That has been directly linked to
Yeah.
a lot of women that have endometriosis, that insecticide. So we spray our room and we go in like 20 minutes later and we think it's all fine. No, it's not all fine. So all these products, especially like deodorants and perfumes, they directly lower sperm count, and they they do affect fertility.
And some of us really like perfumes.
I know. It's
so what do we then do? Stay away from the perfume?
Well, they
or
have
detox regularly.
Well, read your labels. And sometimes when you read labels, you don't even know what you're looking at. So if you can, I would say stay away from. If you're actively trying now. Now, keep in mind you cannot run away from all the toxins in the world. So that's why we take vitamins and antioxidants and all of that to combat to combat these toxins in our system. But one thing we could start with little changes here and there, like those plastics we use at home. The plastics has BPA, which has been directly linked to hurting your fertility. So if you change it just by changing your plastic bowls at home to glass bowls, and don't put your plastic bowls in microwave and stuff like that. Just starting little steps like that would help you. You're making a conscious effort, and you know, to reduce the amount of toxin load, because that toxic load is actually very hurtful to our fertility. Yeah.
Now, we held a conversation, Chukwudi and I, we held a conversation on radio about the stigmatization of infertility.
Okay.
And we were joined by Dr. Afolabi, who stated that research now shows that 1 in 10 Nigerian men do not have sperm. We opened up the phone lines after that for people to call in. And Dr. Nini, out of about 8 calls, 6 of those calls were literally people calling in to say, infertility is spiritual. They did not want to hear. They were like, infertility is spiritual. If someone is infertile, if she can't get pregnant, you have to take her to the pastor. Like, that was 6 out of the 8 calls after he had literally given the most academic study on the stigmatization of infertility and why it needs to end. Right. How can we really attack those grassroots to ensure that we're sending the right message up the hierarchy so that we can stop this culture?
You have to keep teaching them. We can't stop talking about it. You can't stop teaching them. You have to keep educating them, because a lot of people have that belief, actually. But I don't know. I can't argue with something like that. If that's what you think, I have to keep telling you and letting you know that that's not the case. That's not the case. These are facts. These are facts, you know. It's nothing spiritual about infertility. I mean, I don't even want to, I have some words for that person, but, you know, that's, a lot of people think that way, but we have to keep educating. That's why we need to keep talking about it and educating people. It's sad that a lot of people still think that way, but that's just the truth.
Do you think this is something that the churches have to take on, though, to actually start sharing and disseminating the right information to the people that listen to them? Because this is going around. It's a very prevalent mindset. I
think the churches, well, the churches that I go, I think the churches here now are being more open about it, being more open about IVF. Before, in the past, if you did IVF, you can't even bring the baby to church for like a christening or anything. They're like, no, that's not a God baby or a Christian baby. But I think they're being more open now. I think we need a bit of time. Nigerians in general need a bit of time. Like I said, stuff like surrogacy or egg donation. What? No, we don't do that over here. But with time, I think just being able to talk about it more would just reduce that stigma and just let people know that, look, it's just like every other thing. It's just like cancer. It's just like
malaria
just like malaria, for goodness sakes.
All right.
And there's treatment for it.
Okay, so now before we let you go very quickly, we can't deny the fact that there are young people who are sexually active.
Oh, yeah.
And there's a relationship between your sexual habits and infertility.
Yes.
So would you please throw some light on
that's another
that?
thing I wanted to talk about preserving your fertility. This is 2018 now. I don't think that any, mature, sensible person should still be sleeping around without condoms, because you have the risk of, you risk getting sexually transmitted diseases such as chlamydia, gonorrhea, and these can greatly, if not treated, it could lead to something called pelvic inflammatory disease, which could greatly affect your fertility. And most times people say, oh, I didn't have any symptoms. Sometimes they don't have any symptoms. Sometimes you could have a full-blown STD situation going on and you have no symptoms.
So at what point do you know you have to go see a doctor?
If you do, you should not. If you do have sex unprotected, go see your doctor. That's once you know, okay, maybe I slipped up last night or whatever, go see your doctor. Go get treatment for that, because you could actually get something and not know about it. And you don't know, you're living your life having fun, but it's destroying your insides, destroying your reproductive organs.
Sorry, one last question. Do contraceptives have any effect on infertility?
No. Well, there's a belief that when you're on birth control for a long period of time, it kind of, reduces your fertility. But research has also shown that after you get off birth control, majority of people after a year tend to get pregnant within that year or within that year. So if you do have problems, maybe it's something you should go see your doctor about. Most people think, oh no, I was on birth control and that's why. But within that year of getting off, most people do get pregnant. So,
all right.
Yeah.
There's so much we'd like to have a conversation with, and I'm sure that many people who are watching would like to ask questions. So for anyone who has a question they want to ask Dr. Nini,
Yes.
how can they ask?
Well, they could reach me. They could send me a mail, askdrnini@gmail.com, or just simply look me up on Instagram. It's at askdrnini, ASKDRNINI.
All right. Thank you so much.
Thanks for having me. This was fun.
Thank you.
Thank you.
To enjoy more of these our Ogbonge videos when you just watch, press this button to subscribe on top of our YouTube page. You go love am.